Hi, Dr. Ariane from the Movement Paradigm. Did you know that 1 in 7 adults are diagnosed with an underactive thyroid, and 60% of the people with a thyroid condition are unaware that they even have an issue? So it is really important to understand what are the risk factors of having thyroid disease. What are some of the testing that you should do? Why do you get thyroid issues? Why is it so prevalent? And we're going to dive into that today. So what is the thyroid? It is a butterfly-shaped gland that sits right here underneath of our Adam's apple, and it is going to be important for just about every organ system in our body. It secretes 2 hormones, T3 and T4, and that is going to impact everything from body temperature to metabolism, growth and development, brain development, among many other important essential functions in our body. What are some things that can happen when a thyroid goes awry? You could have dry skin and hair, you could have weight gain, you could feel cold, you could have fatigue, hair loss, menstrual irregularities, you can have edema, you could have muscle joint aches, constipation, and lastly, depression. So what are some things that do disrupt the thyroid? Number 1 is stress. And when we think about the hierarchy of how our thyroid might be affected, number 1 is always the adrenals. So when we have a chronic activation of our stress pathway, that means that we are chronically releasing cortisol. Cortisol is going to negatively impact our thyroid function. So adrenals, then thyroid, then our sex hormones. So if we want to think about reverse engineering it of how this might have happened, but also how we want to treat it, we always want to include stress management. Other things that will impact the conversion of T4 to T3 can be things like infections, radiation, medications. Trauma is a really big one. Toxins. So a lot of toxic exposure, things like herbicides, pesticides, plastic water bottles, all the things that are around us can really impact the thyroid function. So what are some other things that disrupt the thyroid function? Nutrient deficiencies. So some of our key nutrient deficiencies that will drive thyroid dysfunction, because the thyroid needs these things for the proper conversion, is ferritins or iron, vitamin D, selenium, zinc, iodine. These are all going to be really key in making sure that we are identifying the root cause of the thyroid dysfunction and also treating it appropriately. So now you know about common symptoms, you know some common causes. Now it's important to look at testing. So as it relates to testing, the most common test that is performed is the TSH, which is the thyroid stimulating hormone. This is going to be a reflection of the pituitary gland, which is what secretes this particular hormone. This can be totally normal and you can still have thyroid dysfunction. So it is necessary and critical to have a full thyroid panel if you are suspecting symptoms. So if I'm looking at a patient, I would look at their patient history, their clinical presentation, and then determine, yes, the thyroid testing is definitely appropriate, but we need to have a full panel. So that would include your TSH, that would include your T3, free T3, free T4, total T3, reverse T3, TPO antibodies, and thyroglobulin antibodies. So it is important to have all of those things so that you can get a full picture of what's happening, and you can also look at specific ratios. If you've been dealing with any of these issues, please make sure to reach out so that we can help guide you on the right path. And recognize that hormone replacement is definitely appropriate in many cases, and it's just a matter of finding the root cause so that you're not just simply putting a band-aid on what's happening. That's why it's really necessary to figure out what nutrient deficiencies you may have, what potential toxins are you being exposed to that are contributing to your condition. So you really want to make sure that you continue to work towards finding the underlying causes of your thyroid condition so that you can continue to feel your best and you can make sure that you are living the life that you deserve. As always, thank you so much for joining. We appreciate your support, and please make sure that if you found this helpful, share it with your friends and family. Don't forget to hit that like button, maybe leave a comment. If you have any questions, I'd love to help you, and I will see you next time.